Today we are going to talk about myths about sex. All virgins have a hymen. The hymen as proof of virginity is a myth. Not all women have hymens. Some women are born with a very small hymen or with no hymen at all. Hymens are in different sizes, plus, they do not cover the vagina completely. Among us there are women who face a real problem, a too thick hymen. And most of the time, the solution is surgical removal. In some countries, genital examination that determines virginity is banned. Determining whether a woman has engaged in sexual activity solely by examining her vagina is impossible. As explained earlier, hymens vary greatly in appearance, making it impossible to establish a definitive indicator of penetration. The misconception that the hymen invariably ruptures during initial intercourse has also contributed to the misconception that the first sexual encounter will be painful. However, it is important to note that discomfort during penetration is more likely to arise from anxiety or sexual inexperience, rather than from the stretching of the hymen. You can contract a sexually transmitted disease from a toilet seat. Viruses or bacteria that trigger sexually transmitted diseases or infections cannot survive outside the body for a long period, especially not on a cold surface such as the toilet seat. In addition, they are not present in the urine. Therefore, the chances of contracting any disease from the one who used the bathroom before you are quite low. You can worry about the direct contact you have with the skin of a person suffering from a communicable disease. A man who's good in bed just knows how to please a woman. Romantic movies, books, and song lyrics usually describe life in the bedroom as a paradise where pleasure is unlimited and lovers simply reach the ninth heaven. Often the reality is quite different. Some men can read a woman very well by being very attentive to her reactions during sexual contact, but the best way to maximize pleasure is to communicate your sexual needs. No one can read your mind. If you're aroused, you shouldn't need lubricant. Many women have periods in their life when vaginal lubrication production is low. Some people believe if you're aroused, you shouldn't need lubricant, but the reality is that people are different. In the same way that people sweat in different amounts, you have some people who experience low levels of lubrication. Other reasons can be the monthly cycle, you're about to get your period, pregnancy, yeast infection, menopause, medications, not enough foreplay, and birth control pills. Desire should happen instantly. Couples who continue to have a great sex life do so because they prioritize intimate time together. A relationship that doesn't work properly or a stressed life decreases the desire for sex. Desire occurs when the desire for sexual interaction comes after external environmental cues. This type of desire might be inspired by sexting, physical touch, massage, watching erotic content, a sensual bath, spending quality time together, and watching your partner undress. Real-life sex is like pornography. Porn can inspire us to try something new in bed or to stimulate sexual excitement, but isn't necessarily the best way to learn how to actually have pleasurable and mutually fulfilling sex. Pornography creates an expectation that things just flow in a specific way and that they will be perfect. In reality, sex is not perfect and people are sharing control with their partner. Healthy sex is more bonding and keeps the other person's desire in mind. Size of vagina. A woman's vagina becomes stretched out from use. Just as some men worry about penis size, more and more women are wondering what the normal size of a vagina is. In a normal state or at rest, when you are not aroused, the vagina measures 7 to 10 centimeters in length and 2 to 3 centimeters in width. During the sexual act, as a consequence of the state of excitement, the vagina increases its width by up to 7 centimeters and its length by up to 15 centimeters. A woman's vagina doesn't become stretched out from use. The vagina is naturally elastic. So if you have sex every day, your vagina will not lose its elasticity. What might happen after birth? Your vagina probably won't go back to exactly how it was before. This is natural and not something to worry about. Pelvic floor exercises can help to tighten up the muscles surrounding the vagina in no time at all. STD tests are only for those who sleep around. We are conditioned to believe that STDs are a promiscuous person's problem. All sexual activities come with some level of risk. A lot of people think that if an STD has been transmitted, there will usually be symptoms or signs of infection. Actually, many STDs are known for being asymptomatic for long periods. You can have unprotected sex with someone that you don't know yet who has an STD, or you can be in a stable relationship, get cheated, and contract an STD from your partner. Needless to say, anyone who is sexually active is at risk of contracting an STD. If he pulls out when he ejaculates, she can't get pregnant. Pulling out is not effective all the time because men don't have the ability and willpower to withdraw at the correct time, every time. When done perfectly, the pull-out method prevents pregnancy 96% of the time. Pre-cum is another risk. The fluid that comes out of the penis before ejaculation sometimes contains sperm. In this case, even if you do pull out successfully, a pregnancy can still occur. You can't get pregnant if you have sex in a bath. Water does not wash away semen or vaginal fluids. Even in chlorinated water, it is possible to get pregnant or contract an STI. Condoms make sex less enjoyable. There exists a misconception that engaging in sexual intercourse with a condom is inferior in terms of pleasure. To begin with, it is crucial to assess whether the appropriate condom was chosen. It's true, condoms can be uncomfortable. This could be because you're trying to use one that's the wrong size for a person's penis. Much like there are variations in penis sizes, condoms also come in different sizes and textures. If a larger penis is fitted with a smaller condom, there is an increased risk of the condom breaking. Conversely, if a smaller penis is paired with a larger condom, it may slip off more easily. In addition to diverse sizes, large, regular, fitted, these sizes all fit differently between brands. Clitoris is just a teeny tiny nub. From the outside, the clitoris might look small, but the bit you can see is just the tip of the iceberg. Most of the clitoris is internal and isn't visible. The visible portion of the clitoris measures approximately the size of a pea. However, the entire length of the clitoris can extend up to 5 inches, 12 centimeters, long. Quite impressive, isn't it? Furthermore, it is interesting to note that during the initial stages of fetal development, both the penis and the clitoris share the same structure. It is only around the 9th week of pregnancy that they differentiate into distinct sexual organs. A bigger penis is better. The experience of sexual pleasure is highly individualized and can differ greatly among individuals. What might be pleasurable for one person may not elicit the same response from another. Some men think they don't need to put in so much effort just because they are gifted with a large penis. So, it is crucial to acknowledge that sexual pleasure encompasses not only physical sensations, but also incorporates emotional and psychological elements. Establishing a sense of comfort and security with your partner, along with the ability to openly communicate your desires and limits, can significantly amplify the enjoyment of sexual experiences. Someone can be good or bad in bed. To think that there is a universal recipe, a chain of gestures, behaviors, or techniques that will blow any partner's mind with pleasure is like thinking that there's a food recipe that pleases everyone. We are all different. People with whom you had great chemistry may say that you are very good in bed, and others may have a different opinion. A good sexual interaction can be influenced by the age and experience of the person, attraction, sharing the same preferences, and open and honest communication. Quality sex involves comfort, relaxation, and trust. The birth of a child benefits a couple's sexual life and relationship. The birth of your first child is a very important event that can change a relationship forever. Even couples who had a great relationship before the baby faced real challenges. The early months after the birth of the child can be challenging for parents. For some couples, the transition to parenthood feels smooth. For others, it can be a time of stress and tiredness that causes them to become distant and withdrawn. Hormones have a big impact on the mother, and the lack of sleep and stress caused by the birth of a child can negatively influence sexual desire. Sex burns a ton of calories and can help with weight loss. On average, you can burn approximately 200 calories per 30 minutes of sexual activity. To lose weight, you need to burn around 1,000 calories per day to lose 1 kilogram per week. Essentially, you'll need to have sex more than 4 times a day for a long period, which is quite difficult. Sex life can be a source of satisfaction and even healing for each individual. However, it is important to recognize that there can also be discomfort, anxiety, shame, or even repulsion associated with this area of our lives. Staying informed about sex can contribute to building healthy and fulfilling relationships, both emotionally and physically. It allows individuals to have open and honest conversations with partners, fostering trust, respect, and mutual consent. I hope you enjoyed this video. Thank you for watching, and don't forget to like, subscribe, and hit that notification bell for more content.